Hey, Rita! 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 I'm not feeling well. And I'm afraid maybe I won't feel. Rita! It's like my hand feeling just a little bit pain here. Oh gosh. I'm calling this lady, but she's not answering me. Let me call my girlfriend. Maybe she will answer because I'm not feeling good. Like feeling dizzy and what kind of... Where is this coming from? Is it overwork or what? Anyway, let me call my friend. And let me see what she can do because I feel the pain, but I can't touch it. Anyway. Rita! Rita!
Sis.
Oh, thank God you're here.
How are you?
Why I call you? I was trying to pack up some things in the house and all of a sudden I'm feeling my hand is just pain, but not so severe pain or something like that.
Your hand?
Yeah, my
Which
hand.
part of your hand?
Yeah, the left one. And it's inside, and if I do like this, I don't feel it. But I feel in my body that inside is paining me.
Really?
And I don't know why. Like headache. I don't know where this is coming from. Really? I don't
Do you feel anything?
Yeah, my chest. It's like it's heavy, like an elephant sitting on my chest. Trust me.
No, let's call the house.
Oh,
doctor.
come on, please. You call the house doctor, what is he going to do? All they are going to say is paracetamol and all those stuff. This is nothing. It's nothing. Only the way it was, from this one to that one. That's why I called you. Trust me.
So you just think just the housework?
Yeah, I think, because look how I see the things that I've been packing. I was ironing, I was hoovering, I was doing all kinds of things here.
V, listen to me.
No.
Your cholesterol is high.
Uh-huh.
You have high blood pressure.
Uh-huh.
You are diabetic. All these things are connected to heart attack. And the
Oh, my sister, stop me this. Heart attack. What does it got to do with this? Huh? What does pain and chest pain got to do with all this?
I mean your health problems.
Oh, come on.
The pressure and
Let's
all
forget
those
about this.
things. No. You just call. If you go and the doctor check you and there's nothing,
You see,
then you can relax. But it's always best.
you are always on doctor. What is all this? I'm just telling you what.
You just call. You
Okay,
just
no
make
problem,
the
no
call.
problem. Let me call. You just call. What is you just call? calling these doctors, what are they going to tell you? They are going to give you only paracetamol and all this. They're not going to tell me anything important, trust me. Because now the assistant will take the telephone and you'll be asking you all kind of stories.
You think they have picked?
Hi, doctor. Is this the assistant? Okay. I'm not feeling not too well and I want to see the doctor, please. What are you saying? Yeah, I want to see the doctor today. Yeah, my body is not feeling good. I want to see the doctor today, please. Yeah. I said I want to see the doctor right now. Because I'm feeling, my hand and my chest. I do too many things in my house here. Today, the household is too much for me. And I'm not feeling good. I want to see the doctor. Why are you asking me all these kind of questions? It's too much, man. I really want to see my doctor today. Take it.
Hello? Yes, I'm a friend. Yeah, I came to visit. Yeah, she was working and after that, she's having a chest pain. It's so heavy and having pain in the hand. Yeah, he feel dizzy. Yeah, it just started just after physical work. And she also is diabetic. She has diabetes and the cholesterol is also, on the file. Oh, okay, what time? Now? Yeah, we can come. Okay. Thank you very much. Okay, bye. Yeah.
What?
He said you can come today.
So surprised. You know these people? When I call, anytime I call, you know how many times they tell me 3 days and 4 days and 5 days and all kind of shit?
Yes, because
of
the way
you see?
Talk, you have to know how to talk to them. I just realized they have a list there. So when you call, they look at what the danger is. That's why they were asking all those questions. Then they ask when you call, they don't even mention your date of birth and all the questions they are asking. You have this, you have that. How long did it happen? How long is the pain? When did this start coming? That was the questions I think they were asking. You got angry.
I was so angry.
So if you give them all that information,
it's good that you can.
Then they'll know it's emergency. You say, your whole body. But when I mention about the
chest, yes,
your hand, and then no, the doctor had to see you. So that's how they give priority to you seeing the doctor. So you should know, how to.
Now I know.
To get an appointment.
Okay. Now I know.
So they said we should come.
You go now?
Yes.
Are you sure they're going to take care of me? This woman is just. When we go there, we're going to sit there for so long.
Let's go. When there was so yet, they say, "I
must show you there." Yeah, for no one back as a mechanic. What's not
a best friend, uncle.
Yes, doctor.
Tell me, how can I help you?
I haven't been feeling too good lately, doctor. I have been experiencing chest pain, shortness of breath, and I also feel very tired lately.
Okay. So, where exactly is the pain located?
It's like heavy feeling on my chest, and it's like something is sitting on my chest.
Okay. Does the pain ever radiate to other parts of the body?
I experience the pain there, and sometimes I also feel the pain in my arm, and my jaw here. Sometimes I feel all this pain.
And Frau, how often do you have these symptoms?
At first, doctor, it will be once in every 2 weeks, but it has become more frequent lately, doctor. I have these symptoms several times a week.
How long does the chest pain typically last?
Usually, when I get the chest pain, it will last a couple of minutes.
And can you tell me when you usually get these symptoms?
Usually, these symptoms come after I have a very busy day or a stressful day, or carrying heavy groceries home from the supermarket. So I thought it was just stress, doctor.
And when do the symptoms go away? Do you take any medication?
Usually, when I sit down and relax for a bit, then the symptoms go away for a couple of minutes.
Okay. Have you been experiencing other symptoms such as sweating, nausea, or fear?
I've been a bit noisier lately, and I have felt a little bit stressed.
I see in your file that you have high blood pressure and high cholesterol, and these are all risk factors for heart disease. Do you smoke, drink?
No, doctor, I don't smoke.
Do you drink a lot of alcohol?
No, doctor.
Well, that is very important. Do you have any close relative with a heart disease?
My father.
Okay. Now, with your history of high blood pressure and high cholesterol, I think you need to be very careful. Yeah. I'd like to take your blood pressure and your pulse frequency.
Okay.
Yeah.
Okay.
First, let me check your pulse. That's fine. Just relax, don't talk, calm down. Yeah. Your feet on the ground and just relax. Yeah. Based on your symptoms, I think you may have what we call narrowed coronary artery. That means a large blood vessel of the heart does not receive enough blood flow. But let me show you. These are the coronary artery. But in your case, one might be narrowed. And so what I'm going to do is I'll refer you to the cardiologist for further testing, and then we will know what is causing the symptoms. After we are done, I'll refer you to the practice on the stoner, where they're going to draw blood, and then they're going to check your blood sugar and your cholesterol.
So, doctor, do you mean I'm going to heart attack and die?
No. It's good that you came in early. So with medication and healthy lifestyle, you are fine. You'll be okay.
Are you sure, doctor?
I'm positive. I'm very positive. Just go and enjoy your blood. Yeah? Okay. So, it's okay with you. Your jackets, don't forget it. Everything will be fine, okay? Okay. Thank you once again for coming. You can see them at the party. Yeah? Everything is fine. Everything is fine. Yeah? Everything is fine. No need to leave. Everything is okay. Okay?
As I was saying, when I reached the doctor, my doctor told me that I nearly get heart attack.
Hey! Heart attack?
Because of the symptoms that I was having at home.
So you didn't take it serious?
I didn't take it serious. And I called my friend and my friend told me, Vivi, no, you have to call your doctor.
Even if you call the doctor, they won't give you anything. Paracetamol. Drink plenty water. Have enough rest.
Then I did. And it was so good that I did. But when I read the doctor, trust me, you know what I had? You were going to have a heart attack.
Hey. Heart attack? Heart attack. A woman?
Hey, a woman. It's not only men. You think only men have this?
Yes. It's only men who have heart attack because women, no. I've never heard of any woman. You hear they say this man get heart attack. Before you know they said he fell down, he died.
And they don't even talk about it. They say it's a taboo. Don't listen to that story, Because me, what happened to me, I didn't take it serious. I didn't even feel like doing anything. But just call my girlfriend. And she told me, hey, listen, just go to the doctor. If I did listen to myself, like you guys won't hear good thing now. But you know what? God is so good that the medication and the things that the doctor tell me to do and everything make this become less. So if I could have waited so long, then it's going to be worse.
Thank God. You have to be very, very careful. Whenever you felt anything in your body, it's better you rush. Like Vivi, she could have died.
Yeah,
From heart attack.
just mild symptoms like that. That weird heart attack makes me sick at that time.
Yeah, because women don't have that. So we don't have no idea that a woman can have heart attack. So even if you're having a symptoms like that, you will not think about heart attack.
Wow.
Because you're a woman.
But also, thanks be to my friend, because my friend just insists, no, you have to. V, you have to.
My dear, we are happy that you're sharing all this news with us. Whenever any of you get these symptoms, it's better you rush to house doctor before it's too late. My dear, we have to give thanks and praises to God. God has done a very great job.
Oh yeah.
You are lucky,
I'm lucky. But you know, this thing, sometimes you have to get somebody who will always push you to see, because we know we don't like going to the hospital. That is our problem.
At all.
Because this thing was just a small pain, and I know it's normal. Maybe I've eaten something that is not good, that's why I want to vomit or something like that. But I was not even thinking this way. Heart attack. I was like, whoa, what are you talking about, doctor?
Thank you so much for sharing this with us. Thank you very, very, very much for sharing this. So now we have idea of it. And in case of any type of movement in our body, the heart, our mind will go there.
But God's so good. The medication that the doctor gave me have let me.
Your body has responded to it.
Yes.
Thank God.
Now my body is responding to the medication, and I'm eating good, and I'm taking all the things that the doctor, tell me to do. I'm doing everything.
So
now I'm okay.
You can cook.
Oh, now I dance. Now I'm
you
okay.
can do everything.
Oh, girl, I'm okay.
Oh, my dear, we are happy for you.
Nice woman like this. Heart attack. Have you heard that before?
Oh, it's there. It's there. Don't take
you
it
and your
as a
taboo.
joke. It's there. Oh yeah, it's there, because people are scared of saying it, voicing it out, let people know that this, but it is there.
It's real.
It's good that you call your friend.
That's the reason why I called my girlfriend, because I needed somebody who I trust, who can be with me before he take me out, bring me to the doctor.
What you did was right, but always call help first. And the help can also call your relative to come and take care of you. To come to you. You are right.
Oh yeah.
You are right.
Now you know everything about it. You don't stay and wait when you are feeling all these things that I'm telling you. You understand?
Yes.
And then, like you said, you have to call the doctor first.
You know, whenever you're at home and you are feeling something strange in your body,
Oh yeah.
please don't wait till it gets worse.
Yeah.
Please go and see your house art before it's too late.
Welcome back, viewers. I hope you enjoyed the movie. Well, most of our viewers, you can recognize this film has been shown several times on Kamp television already, and we had positive feedbacks and also questions that viewers really want to know more about the heart disease. Today, I have the privilege to invite the doctor himself, who is going to answer all the questions and the feedbacks that we had from the community. Stay tuned, and I'll invite my guests to the studio. My name is Veronica from the Kamp, your host. Well, Doc, you are welcome to Kamp Television.
Thank you, Vero. It's nice to be here. Thank you for inviting me.
Yeah, we are so privileged to have you. I feel say I shall for your Ghana need you. And come on back on Ghana so that people will really understand. Viewers will really like to mix it today also for our Ghanaian viewers, because most of them brought this feedbacks. So, Doc, can you let our viewers know who you are?
Okay, thank you very much again. Me doing the Yao Kusi Mensah. Me a doctor. Kulebu, Accra, Ghana. Me a specialist for Ghana. This is here me by Amsterdam. So me be me PhD. It is currently me PhD or IMC Honum for the past 2 to 3 years. Until that's essentially who I am.
Yo. Ahwɛfoɔ mo ahwɛri yɛnya yɛn kurom ni o. Yɛn kurom ni doctor. O kyɛ sɛ mo amunim yɛn problems wɔ kurom ha. Sometimes yɛde yɛasɛm kɔ mo nte ase. Nti ene de yɛnya ne die ɔbɛkyerɛkyerɛ nsɛm mu ama yɛate ase yie. Ti you say Dr. Yao Mensah.
Kusi Mensah, Pachai.
Kusi Mensah. You are welcome to Kamp Television.
Thank you so much.
Into what specialize in what? I mean, when it comes to your doctorate.
Okay. It's my specialty and kasane a friend anesthesia. Just obi baby operation when I'm my omo draw my omo ye omo da obi a pim for be operation as cesarean section me won the chipanier and I face me here ejuma wo be intensive care ICU into omo yare pa omo da machines so na as me here ejuma through power into those are the areas I specialize in.
Oh, great. Now over Amsterdam so no we should said the Ghana ejuma ne te Kolebu ene ahadie no difference be na wo.
We do busasa difference ne there. Mommy, it's a lot. Okay. You know, even though say me PhD na council, I don't really do clinical work with Hano, but me any opportunity akomo ha omo theater ni omo clinical space no. Differences from but the me who party to ne say I mean Ghana doctors no nim gini de nim de no not equipment na njuma no ma de be ejuma no na enye bi we say Hano say no omo no mom de ejuma no be brand new modern technology. So if you Ghana no in the Biania, a white media juma. So those are some of the differences, and I have faces on Ahano, more personnel, and said doctors, a door so saying, patient Munya Botre and the mobile by if you want to doctors, Mr. Me, I'm a doctor, say, between patients bear 1,000 on hand, and also the band sana. So we share no so between about channel, yeah, to be is a bit difficult in telling some of the differences are who on Hano.
Because I have problems, baby. Sometimes you call hospital. We explaining near me be a na a yedin to say be a ma come when I'm yammy basa me me ya na say my ye me feel say my why ya me jury now o casa so which
I want to
but
see.
can any doctor dear casa be when you be basa or tiasie because I believe me call me physio now. I said, and I see a chimney. Now, me explain it, say, me say, the spider catch my leg. What do you mean the spider catch your leg? It's so kind of the doctor because I see a chimney now. You get it.
Definitely.
You know, your best say, Bramo.
Your bumpire say a big opportunity and I make say easy. Maybe say no opportunity in the crime. I don't be na meeting as opportunity. Initially, no, not a day. In fact, funding in your man, then the haban no see a day. But since me buy no, at least your bumpire say we call back or before so back. We started this kind of program. One of your professors know I am si hono or a very popular Ghanaian professor, Professor Ajimai. Inti obi ni inti was started sa inti or the doctors be brief figure now ya ba e be tia nyoma no ha na asan ko back inti is in course e gu so aye de beboa
yes mobile so amount na mama me ba na course coming back to this heart disease say video na man for share you know they love it and they had also some questions about it because in the video no it was like when we show most of the symptoms in there I have say almost say when the thing is not so serious you don't have to go to the ambulance and then we also know say people get heart attack and they die immediate so when we are having these symptoms how can we know that this symptom is very serious it's going to give me heart attack so I have to call the ambulance immediately or wait there or make me train I'm a house doctor no time be obenya time na young crofo confused kakra.
Okay.
Yeah,
thank you for your very good question. Inti once about akumayari na akuma no there are several types of akumayari.
Okay.
In fact, term heart attack no. There are different if it be heart attack, if it be cardiac arrest, if it be heart failure. Uti ni na we feel say ni na ya at the crop at the corner na so enye at the crop. In fact, medical lino different. E ka se obi enya heart attack and once akuma no muscle to say wo muscle wa wonsa no. Nti obi nya heart attack e say moja na supply muscle no e bia ho atochima nti part of muscle no once akuma no to say nam ankasa nti moja na e sa muscle no ho ashort nti ntimi nru ho papa just say muscle no ewu that's when heart attack you people say kind of cardiac arrest just na akuma no stop it complete nti heart attack na akuma no stop here I said, "Why got to maybe our VIP bus or cook my two times house and I said, okay, answer because Moja didn't call 9 moon. I said, I saw 9 war, Sana, a bear wakumana, a friend heart attack. And a heart failure, no, was a commando, a pump. Yeah, more there were Ghana, was a Ghana, they were so near water pump, and I pump you in the coastal. Now, so heart failure, I said, a commando, and yes, but intimate pump, pressure on a woman, no, and no, so to because and Baconia heart failure. This is how new matter now are different. Now, about heart attack, now it's a heart attack. No, I can't stop it completely. No, ubenya signs and symptoms. Ubenya kind of maybe a bit much or no. As a command, if you take a car, we just battery touch my house. I feel stuck here. A chance and I just so no. It's very funny to say it's a heart attack. No, to be sad too. But symptoms nibu was say ubenya coma or chest pain, or chest by your ya, or to be our sanso bay it me ya. To be needs to be chin. So a few other symptoms are a show video no. You can't want some no. Internal symptoms I just say unya heart attack. Now second question I will say and say we know and I will say me friend doctor and I say me train so. Then usually no say as command heart attack na ba so unya symptoms no now it na say now train so kakra na symptoms no kwa. E kire say best na supply muscle no enye completely cut off just say the blocking no enye complete into ORC no mo jana sa be drum biom into no sa no obefra doctor no but it's not any agent say ukon prekupesa, but say o share say na still akoma still chest pain now feeling no that's what her just say vessel no are complete say over pipe na wa block pipe no the pipe no moja ntimi and flow too much just say akoma no nya oxygen na ehia no nti akoma no bewu it is one friend emergency so one friend ntema nko a obenya problem but say if you say a small occlusion o kata so kakra na obia na eba at least no bit match so kakra nti those are some of the differences that meeting about and
okay. If the chest pain no enjana continuous,
yeah.
No, na say immediately no.
Yeah.
To me, a freba, eba na eko.
Eba na eko no sanada. I was like any emergency this time. The eba na eko na any no kwasa offer 112 no. It's emergency ambulance. I know they offer. I saw offer house heart no or house doctor say oh minya symptoms we ebi am ya eko na eba no. Ono be book appointment na wa ban ho. But say oh yeah say chest pain no eda so ho o tena se cry nkwa no need emergency no. You say 112 but it just say moja no endu akoma no. Moja na supply akoma no mason no enu ho intano no air time because I say oxygen some makata wo ne so sa na wontumi home e che bia obey unconscious obitimi bibi betima ayo intano sa no I say offer 112 no ambulance no tempa be foul na say even that time say offer ambulance na wo e do bit say aspirin utimi fa aspirin aspirin e drone no it is aspirin offer drone na etimi bie vessels no na moja kakra so afem
paracetamol
specifically aspirin na aspirin no bebre Ghana you feel friend grandpa edro but aspirin white aspirin to me for aspirin no what's out and after aspirin so e boa ma moja clot you friend be clot once usually vessel no say clot no me share diagram no say clot no moja clot be share to kunumu na block moja no nti usually aspirin no timi ma clot no for me and I say itimi ma who no ebie ma blood no flow through nti whilst you are waiting for ambulance no timi for aspirin and then they find the first aid timi for aspirin no
what's the difference between the aspirin no and the paracetamol
it's a very good question it's aspirin no
parana
the selling na your painkiller but Osha parana drone a woman ankasa paracetamol no e different e first a compound won say the example with a man say you want chine and they were iodinated salt sana to Ghana no o to to enchine bo ha iodinated salt ni num o to seaside salt na and e different but ni na ye enchine
on the kwamunya he na ye
it's iodinated na ye papa e so for iodinated na o fa no sa unya e fa bibi goiter thyroid into here iodinated salts, but with the paracetamol and aspirin no into it's not salt, but back home a drop more a boama or come and be into aspirin no a specific a draw a different paracetamol. Ni na a painkiller, but aspirin there was aspirin a different. Only the baby crack aspirin no intina it me yes a juma na me cano has a for vessels no para intimi yes a juma. Yeah.
I see. It's when you are having these symptoms now. So we be say we jai.
Yeah.
Or you can still move around and do anything you are still doing.
Yeah. It's symptoms no also symptoms no you were different like grade. Obu ha chest pain ebeba a very dull. E sheda and stop no. E be obu say e ba ne den san one cry obi an catch set na ase. Wa obet na ase.
Okay.
Obu ha so but so when your chest pain na I was so monitor say okay ejuma na me ye no me jai no pain no call form and I say pain no twaso and nobody who say we na ya ambulance na my friend na and I say house heart na my friend on me patch nti usually no so we bibi na we say also usually say enye den sana most people would continue doing their work then the pain gets getting worse if it's getting worse it means that you need to slow down now so the way no so ujai na so otiso just to make sure say because I just say all stress akoma no ade uma moja na ekono enso no na wosa ma na djuma mo so onye sana akwakoye.
Now how can you prevent symptoms?
Yeah, inti very good one and they say most of symptoms no also about blood vessels na FBB atherosclerosis the change more set
yes I say the narrow
coronary vessels artery. It mean me diagram be by. It will share me picture na me kyerɛ wo na. One say first one no. Emu demu clean. She ni moja no we entini na e de moja kɔ akoma no. But we no yare abamu. One say ade yellow bi wom. E fe no plaque. And then e fe no arteries e plaque. It wa o share aha no tokono so. Aha no tokono abe ketoa. Nti say aduane na yedidi ni nneɛma na yɛyɛ no ɛna ma saa yellow ne form yellow ɛyɛ sradeɛ ɛyɛ fat nti udidi nnuane a sradeɛ ne nneɛma ne wɔn na akɔhyɛ ahanimu no na asɛ wɔ sink na efi ekemu a na asɛ afei na toko no afei abɛyɛ very narrow nti du baby na woyɛ bibi na onya clot a blood clot for me a na asimu completely te sɛ ano mogya ne ntini ɛmfam ɛte sɛ we nti yeah, ma so wodi fatty food, a situation nchini bebre wo duane mu onye exercise like onye physically active e ma strade no ekokakaka ontini ni mu saa no bedu bebe no afi ye bibi kakra na ablock na afi moja na ntimi nko blood vessel no ntimi na ye coronary artery na ye ka no and the supply akoma no with moja nti saa na akaka koye
ti saa entini no ono a dose.
Tu share picture na also entini no bebre picture. Entini no bebre enini. Vessels no eno ani ebi ni red and blue. Red one na di moja ne ko. Na blue one no edi moja nti akoma na nkasa we akoma. Na akoma nyina na ye friend muscles no. Nti say entini no a di moja ne ko akoma no ho no. Say bibi be hye na e block na moja ne ntimi ndru muscle no. Na fe enya oxygen because we hear oxygen we hear from a de be feedi cell na fe atete say nti sa na akokoye ntini no
today to me blocking no any fats no
yeah and srade na me kire ha na say ade yellow na e wa ase no srade we na e srade e fat e fe na atherosclerosis e fat nti say wudi eduane a na obeka say na mindi fatty food but e si kire eduane no once the body no etimi convert wudi si children and salt na etimi convert eno ko fat nti obi a okasa omi de me pay aduane a me nom oil me fa me pay fat me this rade but so wudi sugar bebre na sugar no go say body na e limit e sugar na do so na afi atate esesa no e ko srade ona me pache onu wudi so bebre a edu level bi a na body na esesa no e ko srade combination no nti say wudi nyoma bebre ne sa na body no ebe dane no into sa srade na me kire no na afi abehihye intini ni mu no afi intini mu no toko na yeketwa nti bibi ka kra be hyem a e blocking na eno ano no na afi a blocking blood supply no
ti sa kuma yare
yeah
chesa jena edeba is it because we near with age or is it our lifestyle na ma yenya kuma yare
yeah. So risk factors no dey bebre and me Ghana ni a intino meka dey specific to Ghana for the risk factor no because the risk factor dey ma boni nya no eno ye different dey ma bibini te say me yenya ye bibi for no and na me hu research a ye bebre ni say ya hwe say one your lifestyle no any nuane a key factor and na age to ka ho but age ni dey abrofo yes abrofo so sa age no affecting but the be before no lifestyle in nuane no in fact research for the past 2 years research I made no me share in Ghana for duane any obesity in fact me share Ghana for no mote Netherlands ha na me de compare Ghana for na mote Kumasi Urban Ghana say Chrome and omo mote in class no na me ye research no say omo mote in class no omo duane yenim duane omo di potin but omo akoma yare no omo nya akoma yare te so omo mote Chrome say Kumasi ni Accra and omo mote Amsterdam in fact say o compare nipa 3 year Amsterdam for no kan na ye west it ye kohwe mfihwem ye say duane no ka ho won say udi duane a esichiri won say aba abrochi na oti Kumasi oti Kroma udi duane unni ahaban unni fresh vegetables unni sa duane na ye fresh no de be processed food burger chips sa nyama ne a nchinu mu no na bebre omo Chrome na omo Amsterdam and say city center na abrochi no mudi nti man say no affect yen before no after so physical activity if I say exercise also before no even say what city and so what abroaches and pressure no womb I edding into tell me time I exercise no fine yes adaje no ebi anopo ko ejuma bebe nwumre time no de be exercise no into ya hwe ya hwemu say no it's afi before no research no share say omo te abroche and omo Ghana big cities no fine exercise tini na ka ho na yare no e de etimi e before no saying about for the last one no so if be genetics yes say they make it up ye before no ya hwe say genetics no and I can't say I made the shame, but my genetics no Emma yen so yenya akomayare no more sin abrofo no we be kind of scientist so na risk factors no in the womb
to say bia o mama o papa and as a family member be what not just say risk of having the heart disease near high
yes
na say we hwe ni ye so who say family ni mai say we are careful with it
ampa no cran one nti wo hwe obusuo mu na wo hwe omo yare na wo obusuo mu na wa hwe say wo higher risk factors no obi a ne busuo mu no ebisa yare bi mu eni
because before na yen dey nim say nka heart attack dey mbema mbema yesi o ba fedie ye den na fedie ko emma ne so yen hye na ha na so bi fi mu kra na mostly no the cause of death no makata so te emma ye hu say ba because heart attack pa ye titi nyina de ye mbema ntemba zo to minya pa
they say until manus to me but yes a woman more say because like a risk factor and stress risk factor also mema no omuntimi stress mema no more stress say man no risk stress risk factor but now say no make research na I hwe who say in fact man no suit me pa it's almost becoming virtually equal say man and mema no
because stress no
more stress na say wa ba broche and now into only mema ko oba so ko into ebusiafo go so esa o mani fie it's na ka stress no ho into in fact you call Ghana and say no they two Ghana for no say about for no more stress pa into ya muntu mo boma because stress na modi go omo so no ama bebre yare ama bebre yare into affecting my affecting mema so but mema na more but say an ma no na meka no say an hu say ma no bebre timia sa heart attack no
doc we are so happy say Nyankopon de wa dom yen e wa ha you hope say obeba often kwatem bia beba bia no Kamp TV ma yente wonka na be ma yen information say so ma me no papa wonua no ma ye wa ha e de afutuo na wo de ma yen e fa heart diseases so
yo me da senti afutuo akakra me ma wo say heart disease no e wo ho pa na symptoms no wo ho say na abrochete no aha no nyame adom so for ambulance e beba it is so wa utimi hu de ye wo no na so ano ntem so wotena ho cha etimi de be friend na ye too late it akomayare ne de hu symptoms so akomaye wo ya twen so kakra wo hwe say oye o twen so na ekwa ehun hia no afro house doctor no and house heart no but o ye na symptoms no nkwa so for ambulance no na precopa ye be fa wo ye so ano ma afi so mo hwe mo lifestyle no mo didie no ye you know say stress ne de e wo mo so but at least lifestyle no didie no mamu didi late obi ko tumi ko adwuma ba 9 afi na obedi fufu emwa didie no mo esiche duane na so mutwa so nchine duane no so mo so because mo ye before no ye wo risk be sin abrofo na fi exercise so utimi even a day utimi ye wo 90 so to be a we say fa bars kikiki no bia nante kakra na fa bars no to aso enu nyina aboa and say opo adwuma answer am say the mo pa me manage mo pa say mo per bike cycling no timi me ba say ya bike na me dey ko bibia no sa bike cycling no me fa we in feel me sika timi koto car timi nya bike na ebeboa physical activity no because say a gym na dey boy din but no ma obi kakra bit my own nante and so bit my so untimi ka bike na kra nante ni so if say obefa bus stop no dey na ti ko enim kakra dey kofa honom ani nyina beboa at least 30 minutes utimi nante 30 minutes o ko adwuma na ba na 30 minutes a ebeboa na aboa ma risk no aba from kakra ti if we talk kakra me dey go on
adofo we dey ya yemba o ya ye nua bema Dr. Yao Kusi Mensah. Where dear, or my upon a papa. Ye dison so a ebe boye. Dog, because ya chef for no enya Ghana phone kwano. Nka de watch mu amayen. Ka wo summarizing the kakrebi in English. Said the beya, woman tea and chrome casansonka, one betiase.
Sure, yo. So essentially, what we've been talking about is heart diseases. We've been looking at the risk factors, we're looking at the signs and symptoms of heart diseases, especially heart attack amongst migrant populations, specifically the black population. What we've identified that there are certain signs or symptoms that tell you that you're having a heart attack. The key sign is that you have a chest pain. Some describe the chest pain as a crushing chest pain or a very dull, aching chest pain. And the pain sometimes can spread to your left hand or to your neck. When you see that you're having a pain like that, you have to wait. Whatever you're doing, sit down, stop and relax. If the pain doesn't go down, it means that you are actually having a full attack, which is an emergency. You need to call the ambulance, the 112 number, for them to come and pick you up. But if you sit down or you rest for maybe 5 minutes and the pain goes down, yes, you may be having a heart attack, but it's better to call your house doctor or your general practitioner or your doctor and describe the symptoms to him, and then he or she will give an appointment to come and do some further investigations, because several things can cause chest pain. It's not just a heart attack. Second thing we were talking about was the risk factors. They're saying that your lifestyle, your physical activity, the lifestyle we're talking about, the kind of food, your diet, the food you eat, and especially for those of us from Ghana, our diet has a lot of rich in a lot of sugar, a lot of carbohydrates. Our diet has a lot of salt and a lot of fat, and we need to cut down on those foods because it affects our blood vessels, like I showed earlier. Again, you need to cut down on certain things like alcohol consumption and cigarette smoke. They're all risk factors that cause these vessels to have all the problem. And we were talking about physical activity. One of the things that we spoke about was that you need to be more physically active. If you can, as much as you can, try and walk at least 30 minutes every day. So instead of, if you're going to take the bus or the metro, maybe walk 30 minutes. Instead of taking the bus stop right in front of your house, why don't you walk maybe some 15 minutes down the road to the next bus stop, and then you catch the train. If you can ride the bike, because Amsterdam is very, Netherlands is very available. You can ride the bike to work and back, and that will also help with the physical activity. And then finally, we spoke about stress level and how to manage your stress. That there are a lot of things that are stressing us as, foreigners or migrants in Netherlands. But you need to be able to manage the stress properly. Have a way of relieving the stress. Sometimes, take a walk or go to the park just to release the stress, because stress is one of the risk factors. And I believe that if we can do that, it would help us when it comes to reducing heart attacks amongst the migrant population. Thank you.
Thank you so much, Doc. Well. Viewers, I think most of the questions and the feedback we had from the video has been answered by our honorable doctor. We pray and we wish he will be back again to give us more information. And Doc, I don't know, but I just want to thank you. And on behalf of the Ghanaian community, we are so grateful to have you. What's your take-home message for my viewers?
So my take-home message is, take care of yourself. Heart attack is real. Take care of yourself.
Take care of yourself. Heart attack is real. This the message from the doctor. I hope we'll take this and all the advices that he has given to us, we will try to go along with it, and it will really help us. Heart attack is real, as he said. Thank you. My name is Veronica van der Kamp, your host and the health ambassador, and I've been talking to Dr. Yao Kusi Mensah. See you next time.
This video is about recognizing a heart attack and when to see a doctor. The heart is an important muscle because it pumps blood throughout the body, providing oxygen to all organs. The heart itself also needs oxygen. The large blood vessels around the heart, the coronary arteries, supply the heart with oxygen. A coronary artery can become blocked, for example, by too much fat, also called cholesterol. When this happens, the heart does not get enough oxygen and the heart muscle can get damaged. This is called a heart attack. A heart attack almost always causes symptoms. The most common symptoms for both women and men are pain or a pressure-like feeling on the chest, pain that radiates from the chest to the arms and jaw, often in combination with shortness of breath and rapid breathing, sweating, or nausea. People can also experience other symptoms, such as fainting, heart palpitations, and pain that radiates to the back, shoulders, abdomen, and neck. Both women and men can have these symptoms, but they are more common in women. It's important to take these symptoms seriously and seek help in time. If you have these symptoms while at rest, such as when sitting or lying down, and if they don't go away on their own, call 112 or your doctor immediately. It's important to seek help as quickly as possible. If you only have these symptoms during physical activity, or stress, cold, or strong emotions, and the symptoms do go away when in rest, also call your doctor. It's not an emergency, but it is still important to seek help. The doctor can investigate the cause of the symptoms. For example, a blood vessel might be narrowed. By seeking help in time, you can prevent a narrowed blood vessel from becoming completely blocked and the heart getting damaged. The doctor can prescribe medication or give advice on how to live healthier. The doctor can also refer you to the hospital for further tests.